Hi guys, a word about blepharoplasty or lid job. Eyelids, the upper eyelids as well as the lower eyelids. So usually combined in along with both the upper and the lower eyelids, and a lot of times we consider it a part of the package for the facelift and the blepharoplasty as a part of anti-aging procedure of amazing value. So what is done in the upper blepharoplasty is we cut out we reduce the hooding of the upper eyelid. Before that, we have to ensure that, like for example in my case, now the brow is sitting quite low, and therefore I will require a forehead lift in particular along with the blepharoplasty if required. If I were to only go in for a blepharoplasty and reduce the hooding, I will not get a fantastic result. But I should know that my forehead needs to be lifted up. The brow needs to come in the male. It needs to definitely come at the edge of the bone. In the ladies, it will definitely need to be perked up slightly higher. Having said that, the upper blepharoplasty will give rise to reduction of the hooding of the eyelid, make the eye appear bigger and more youthful. Along with that, the lower blepharoplasty. Lower blepharoplasty has either an incision running down below the lash line, and it is hardly ever seen, but better than that is what is called as a transconjunctival incision. So that is on the inside of the lower eyelid. We make an incision, go into the to reduce the fat pad, flatten it out, and then you will have a deformity such as in my case, wherein there is hardly any bag, not much of excess fat which is seen, but definitely a hollowing, which will have to be filled in by either a dermal filler, but since you're already going in for a surgical option, then belly fat. Usually the fat grafting, which does a very good job. It gives a beautiful contour to the to masking and making the youthful appearance of the lower eyelid come in. Along with that, there can be use of lasers, carbon dioxide lasers, or even what we usually now use Morpheus 8 in trying to tighten the skin in this area along with these procedures, so that it gives a more pleasing look to the whole face. The downtime in blepharoplasty will be about there will be swelling which will give rise to shutting or narrowing of the eyes, but it can be tackled very well with cold compresses and reduction of the swelling and so on, and by about 5 to 7 days it is gone. Usually the bruising takes about 7 to 10 days for it to subside, but once again you looking at downtime of about 2 weeks out of public glare. If you have to go for office work, there's no problem. You can wear cool dark shades and go for work, and there's just no problem. The lower blepharoplasty, if it is done through the transconjunctival incision, the stitches are not given. This heals miraculously by about 24 to 48 hours. It is sealed shut. The top of the upper blepharoplasty incision is usually it has either absorbable stitches which dissolve by about 7 to 10 days, or manual stitches or non-absorbable stitches which have to be removed by about 7 days. And the scar here is hardly seen, so to say, by the end of about a month or so. So it's a fantastic anti-aging procedure of value. Cheers.